So what do you need to know about stroke and your risk factors? First thing, one of the most important things is to know your blood pressure. It's very important to know what your basic numbers are so you have a starting ground, as well as if you have a history of high blood pressure in your family. You also need to know, do you have a regular or an irregular heartbeat? Because that heartbeat, especially as you get older, can be a risk factor for having a stroke. You also, if you're smoking those cigarettes or chewing that tobacco, you need to stop doing that immediately. That's like a non-negotiable throughout this whole conversation that we're having today. If you're not exercising, start out slow, but you definitely want to add exercise into your diet. Start out by walking a couple blocks a day, speed that up until you're able to, have at least 30 minutes of vigorous exercise in your diet, into your day, 3 to 5 times a week. And the reason that's important is the more we exercise and the more we keep moving, that blood keeps moving so that we don't become sedentary. And exercise not only gives us a healthy heart, but keeps our vessels from developing those clots that can go to the brain and cause a stroke. You also want to eat healthy. Now, I'm not saying that you have to stop eating all your meat and all the fatty foods and go clean out your refrigerator, but you want to do things in moderation. And it's just like when we set those lofty New Year's resolutions at the beginning of the year, we know by February 15th that if they're too great, we're not going to keep them. So do small, little goals, baby steps, and celebrate those small wins. So when should you start thinking about your stroke risk? Today, right now. And the reason being is we see strokes as early as newborns, all the way up to great-grandma coming in with a stroke. So the best thing to do is when you have your annual checkup or you go every other year, have that conversation with your doctor. Have your blood pressure checked. Have your blood cholesterol numbers checked. And keep an eye on it. If you're not feeling well, it doesn't hurt to go to the doctor and have that conversation because you're the one that's in control of your health.